Pancreatic cancer is one of those diseases that can remain difficult to recognize until it has already begun to affect other parts of the body. The problem is not always that there are no warning signs. In many cases, the signs are present, but they are subtle, gradual, and easy to explain away. A person may notice that they are more tired than usual and assume they are simply getting older. They may feel discomfort in their back and blame arthritis. They may lose interest in food and think their appetite is naturally slowing down. They may even notice changes in their urine or bowel movements but decide to wait and see whether things return to normal. Most of these symptoms can be caused by conditions that are far less serious than cancer. That is important to understand. One symptom by itself does not mean that you have pancreatic cancer. However, when a change continues, becomes more noticeable, or appears together with other unexplained symptoms, it deserves proper medical attention. The pancreas is a small organ located deep inside the abdomen, behind the stomach. It plays an essential role in digestion by producing enzymes that help break down food. It also produces hormones, including insulin, that help regulate blood sugar. Because the pancreas is positioned so deeply inside the body, it cannot usually be felt during a routine physical examination. A problem developing there may not cause obvious symptoms at first. When symptoms do begin, they often depend on which part of the pancreas is affected and whether nearby organs, nerves, or ducts are being compressed. One change that should not be ignored is urine that becomes unusually dark. Dark urine often occurs when a person is dehydrated. It may also be caused by certain medications, vitamins, foods, liver conditions, or urinary problems. In many cases, increasing fluid intake causes the urine to return to its normal color. However, urine that remains dark or repeatedly becomes dark despite normal hydration may require further evaluation. The pancreas lies close to the bile duct, a narrow passage that carries bile from the liver toward the small intestine. Bile contains bilirubin, a yellow substance that is normally processed and removed through the digestive system. If something blocks the bile duct, bilirubin can build up in the bloodstream. The kidneys then remove some of it through the urine, causing the urine to appear dark yellow, brown, amber, or similar to the color of strong tea. The important point is not one unusual trip to the bathroom. It is a change that continues or keeps returning without a clear explanation. Dark urine becomes more concerning when it appears together with pale stools, yellowing of the eyes, itching, abdominal discomfort, or a loss of appetite. When these changes occur together, it is important to contact a healthcare professional promptly. Another possible warning sign is pain that begins in the upper abdomen and travels into the back. Back pain is extremely common, especially as we get older. It may come from muscles, joints, spinal discs, posture, an old injury, or arthritis. Abdominal pain can also result from indigestion, gallstones, ulcers, constipation, or acid reflux. Pain connected to the pancreas may feel different from ordinary muscle or joint pain. It may begin as a dull or deep ache in the upper abdomen, sometimes directly below the breastbone or slightly toward the left side. The discomfort may then move through the body toward the middle of the back. Some people notice that the pain becomes worse after eating. Others find that lying flat makes it more uncomfortable, while sitting forward brings temporary relief. This pattern does not confirm cancer. Pancreatitis, gallbladder disease, stomach ulcers, and several other medical conditions can produce similar pain. What matters is whether the discomfort continues, repeatedly returns, becomes stronger, or begins interfering with eating or sleeping. When speaking with a doctor, describe the pain as accurately as possible. Explain where it begins, whether it spreads, when it becomes worse, and how long it has been present. Specific information gives the medical team a much clearer understanding of what may be happening. Another change worth watching is feeling full after eating only a small amount. Appetite can naturally vary. Stress, medications, digestive discomfort, dental problems, and changes in activity can all affect how much a person wants to eat, but regularly feeling full after only a few bites is different from simply not feeling hungry. The pancreas sits directly behind the stomach. If a problem in that area begins placing pressure on the stomach or the beginning of the small intestine, Food may not move as comfortably as it once did. A pancreatic problem may also interfere with digestive enzymes. Without enough of these enzymes reaching the small intestine, food may be more difficult to digest. This can lead to bloating, nausea, gas, indigestion, and a heavy feeling after meals. Over time, a person may begin eating less without fully realizing it. They may leave more food on the plate, avoid meals because eating feels uncomfortable, or stop enjoying foods they previously liked. This becomes particularly important when early fullness is followed by unintentional weight loss. Losing weight after changing your diet or increasing your activity is expected. Losing weight without trying is not something that should automatically be celebrated, especially in an older adult. Unexplained weight loss may occur because a person is eating less, absorbing fewer nutrients, or experiencing a change in the way the body uses energy. A noticeable drop in weight over several weeks or months should be discussed with a healthcare provider, particularly when it occurs with pain, nausea, weakness, bowel changes, or reduced appetite. Yellowing of the skin or the whites of the eyes is another symptom that requires prompt attention. This yellowing is called jaundice. It develops when bilirubin builds up in the bloodstream. Jaundice can be caused by gallstones, liver disease, infection, medication reactions, blood disorders, or a blockage affecting the bile ducts. When a growth develops near the head of the pancreas, it may press against a nearby bile duct and prevent bile from draining normally. The eyes are often the first place where the yellow color becomes noticeable. In people with darker skin tones, it may be easier to see in the whites of the eyes, the gums, or the palms of the hands. Jaundice may also occur with dark urine and unusually pale, gray or clay-colored stools. Some people develop intense itching without a visible rash. This may happen when substances associated with bile begin accumulating in the skin. The itching can be widespread and may not improve with ordinary lotion. New jaundice should never be ignored or watched for several weeks in the hope that it will disappear. It needs medical evaluation because the cause must be identified. When jaundice appears with fever, vomiting, severe abdominal pain, confusion, or rapidly worsening weakness, urgent medical care is especially important. An unexplained blood clot can also be associated with an underlying illness. Blood clots are not unusual, and there are many possible causes. They may develop after surgery, prolonged bed rest, hospitalization, injury, long-distance travel, or the use of certain medications. Some people also have inherited conditions that make their blood more likely to clot. Cancer can sometimes change the body's clotting system. In certain cases, an unexplained blood clot may be one of the first signs that leads doctors to investigate a deeper problem. A blood clot in a deep vein of the leg is known as a deep vein thrombosis. The affected leg may become swollen, warm, tender, red, or discolored. The pain may feel like a cramp, a dull ache, or a heavy pressure. It often affects one leg more than the other. The greatest danger occurs when part of the clot breaks away and travels to the lungs. This is called a pulmonary embolism. Sudden shortness of breath, sharp chest pain, coughing up blood, dizziness, fainting, or a rapidly beating heart are emergency warning signs. These symptoms require immediate emergency assistance. An unexplained blood clot does not mean that someone has pancreatic cancer. However, when a clot appears without a clear reason, particularly in an older adult, the medical team may need to consider whether another condition is increasing the risk. Persistent digestive problems can also be an important clue. Nausea, indigestion, bloating, constipation, diarrhea, and gas are common symptoms. They may be caused by food intolerance, reflux, infections, medications, gallbladder disease, or many other conditions. What deserves closer attention is a digestive change that is new, persistent, or gradually becoming worse. Some people with pancreatic disease begin feeling nauseated after meals, especially after eating foods that are rich or high in fat. Others develop bloating, stomach pressure, excessive gas, or discomfort that lasts long after eating. Vomiting may occur when food is not passing normally from the stomach into the small intestine. No single digestive symptom points directly to pancreatic cancer. The pattern matters more than the individual complaint. Nausea that occurs together with early fullness, weight loss, upper abdominal pain, dark urine, or pale stools needs more attention than occasional indigestion after a large meal. Repeatedly using over-the-counter remedies may temporarily reduce discomfort. But temporary relief does not always explain why the symptom keeps returning. Fatigue is another common symptom that can easily be dismissed. Everyone feels tired from time to time. Poor sleep, stress, pain, medication side effects, anemia, thyroid problems, heart disease, lung disease, depression, and nutritional deficiencies can all reduce energy. The fatigue that deserves medical attention is a noticeable change from your usual level of strength and activity. You may sleep through the night but still wake up exhausted. Tasks that were once simple may suddenly feel difficult. Walking through the store, preparing a meal, carrying groceries, or climbing a short flight of stairs may require much more effort than before. Rest may help briefly, but the tiredness quickly returns. This does not mean that fatigue is caused by cancer. It means that persistent fatigue should not always be accepted as a normal part of aging. When tiredness appears with weight loss, appetite changes, digestive problems, jaundice, or persistent pain, the full pattern should be evaluated. It can be helpful to keep track of when the fatigue began and which activities have become harder. This allows your healthcare provider to understand how significantly your daily function has changed. Changes in stool are another subject that many people feel uncomfortable discussing, but they can provide useful information about digestion. The pancreas produces enzymes that help the body digest fat. Those enzymes travel through a small duct and enter the small intestine. If the pancreas is not producing enough enzymes, or if the pathway becomes blocked, fat may not be absorbed normally. The stool may then become pale, grayish, yellowish, greasy, oily, or unusually foul-smelling. It may float more often, stick to the toilet bowl, or become difficult to flush. This type of fatty stool may occur in several conditions affecting the pancreas, liver, gallbladder, bile ducts, or small intestine. Diet and certain medications can also temporarily change the appearance of stool. One unusual bowel movement is not usually a reason for alarm. A repeated or persistent change is more important. Contact your healthcare provider when pale, oily, floating, or unusually foul-smelling stool continues, especially if it occurs with weight loss, abdominal pain, nausea, dark urine, jaundice, or reduced appetite. There is one additional change that deserves attention in adults over 60, and that is newly diagnosed diabetes or blood sugar that suddenly becomes difficult to control. The pancreas produces insulin, so diseases affecting this organ can sometimes alter the way the body regulates blood sugar. Type 2 diabetes is common, and the vast majority of people with diabetes do not have pancreatic cancer. However, new blood sugar problems that appear together with unexplained weight loss, abdominal pain, jaundice, or digestive changes should be discussed carefully with a healthcare professional. The same is true when diabetes that was previously stable becomes unexpectedly difficult to manage. After hearing these possible warning signs, it is important not to panic. Dark urine does not automatically mean cancer. Back pain does not automatically mean cancer. Fatigue, indigestion, weight loss, and bowel changes can all have many different explanations. The real concern is a symptom that is new, persistent, worsening, or appearing together with other unexplained changes. Ask yourself whether the problem has lasted longer than expected. Consider whether it is interfering with eating, sleeping, walking, or normal daily activities. Think about whether several changes begin around the same time. Those details can make a meaningful difference during a medical appointment. Before seeing your healthcare provider, write down what you have noticed. Include when the symptom began, how often it occurs, whether it is getting worse, and what seems to trigger it. Bring a list of your medications and supplements. Mention any recent weight change, appetite change, digestive difficulty, new diabetes diagnosis, or history of blood clots. Try not to describe the problem only by saying that you feel unwell or that something feels wrong. Instead, explain exactly what has changed. You might say that you have felt full after eating half of your usual meal for the past 3 weeks. You might explain that pain begins in your upper abdomen and travels into the middle of your back. You might mention that your urine has remained dark even though you are drinking normally and that your stools have become lighter. Clear descriptions help your healthcare provider decide whether blood tests, imaging, or another type of examination may be appropriate. There is no routine pancreatic cancer screening test recommended for every healthy adult. Certain people with inherited genetic conditions or a strong family history may qualify for specialized monitoring. But for most people, the process begins with recognizing persistent symptoms and reporting them accurately. New jaundice, significant unexplained weight loss, persistent upper abdominal pain, and major digestive changes should be evaluated promptly. Sudden difficulty breathing, chest pain, fainting, coughing up blood, or signs of a serious blood clot require emergency care. The purpose of recognizing these symptoms is not to assume the worst. It is to avoid dismissing an important change simply because you are getting older. Aging may affect energy, appetite, digestion, and mobility, but persistent pain, jaundice, unexplained weight loss, and major changes in bowel habits should not automatically be considered normal. You know your usual patterns better than anyone else. When something changes and does not return to normal, pay attention to it. Write it down. Speak clearly with a qualified healthcare professional and make sure the entire pattern is considered. Most people who experience one of these symptoms will not have pancreatic cancer. But every person deserves a careful explanation for symptoms that continue, worsen, or begin affecting daily life. Awareness is not the same as fear. It means listening to your body, recognizing meaningful changes, and seeking appropriate medical advice before a problem has more time to progress.